The Trump administration is reclassifying state-licensed marijuana as a less dangerous drug. The announcement came today from Acting Attorney General Todd Blanche. Fox 7 Austin's Jenna King has more on what that means for Texas. She's in the newsroom with details. Jenna.
Mike, the order reclassifies medical marijuana from a category reserved for drugs like heroin to a category which includes medications like Tylenol with codeine. Following a December executive order from President Donald Trump, the Justice Department and Drug Enforcement Administration announced Thursday that certain marijuana products, including FDA-approved and state-regulated medical cannabis, will now be classified as Schedule III under federal law. The DEA defines Schedule I drugs as drugs having no currently accepted medical use and a high potential for abuse.
You've got products, items there like heroin, like LSD, very strong drugs with high addiction potentials.
Schedule III drugs, by contrast, are considered to have a moderate to low risk of dependence. Acting Attorney General Todd Blanche says the change will allow for more rigorous research into marijuana's safety and effectiveness while expanding patient access and helping doctors make more informed decisions.
We've already been third-party lab testing our products, reviewing customers' IDs, all of this stuff. So it really, the only change that happens at the federal level is opening up that research, which is going to be crucial.
Nicholas Mortellaro, owner of Botanic Bliss Cafe and Lounge in Central Texas, says day-to-day operations won't change, but the impact long-term could be significant.
This allows us to do that research in a clinical setting, peer-reviewed, placebo-controlled clinical trials, without having to go through the extraordinary amount of red tape that exists for a Schedule I compound.
He says operators in Texas's compassionate use program could see loosened restrictions on their products and a major tax break.
We don't want to take away marijuana from anybody that needs it, because there are people that need it and use it the right way. But there's also, just like alcohol, we know it's legal. There's people that follow what they're supposed to, and there's plenty of people who get DUIs. So it's just part of the situation of unintended consequences whenever you have a substance that can impair you.
But some worry the change could be cause for concern.
Anytime that a drug is not Schedule I or Schedule II, or a drug is legalized, okay, like where they're going to be Schedule III or legalized, it doesn't really matter. Both do the same thing. You can no longer test for that drug.
The National Drug and Alcohol Screening Association advocates for employers' right to have a drug-free workplace. Phil Dubois with the NDASA says workplace safety rules could be at risk, especially in transportation. He says the current safeguards in place have been in effect for almost 40 years.
Pilots, we got school bus drivers, we got truck drivers, we got transit drivers, we got subway drivers, we got pipeline workers, railroad engineers, people that work on the railroad tracks. All those people are tested for marijuana, and if it goes through like they're trying to, without a safety carve out, then there'll be consequences, unintended consequences.
The National Drug and Alcohol Screening Association says that it will be filing a lawsuit in the meantime. The DEA has also launched an expedited process to consider moving all marijuana to a Schedule III drug, with that hearing set for June 29th. Back to you.